Thank you guys so much for the amazing pitches. Really enjoyed that. So there's a huge artificial intelligence angle to most of your businesses. And I'm really interested to know what you guys see the future of that space is and how it'll impact the human element of the physician. Heiko, why don't you take this one first?
Sure. So AI will be important, but AI will never replace the family physician or the specialist. So we see with the explosive growth of healthcare costs, right, it's getting unwieldy for most regions, that healthcare organizations will want to move those costs to lower cost resources. So from specialists to family physicians to nurse practitioners, but we also think that this includes the machine or AI, right? So the AI can take over the more mundane or routine tasks that a specialist or a family physician needs to do but doesn't need to do, right? They can be taken over by a much cheaper, lower cost that's actually going to be more accurate at most of the time. So,
great. Reed, anything to add there?
Yeah, I want to echo what Heiko said and add that, you know, for us, we like to say that a pulmonologist without a way to track cough is like a cardiologist without a blood pressure cuff. So there's a way in which the AI is necessary because of the characteristics of cough. It's stochastic, it needs to be tracked over time in order for us to understand what any one person's cough looks like compared to population or baseline. And so the AI is going to allow us to do things that we couldn't do, but it only can be harnessed, interpreted, and utilized in the hands of a family doctor or a specialist.
And so Oliver and Tina, you guys both have a strong AI component within a diagnostic, right? And that's not usual, it's not traditional, especially for our regulatory bodies. And so I'm just interested to hear a little bit more about how you guys are blazing that trail and what you're going to do to make sure you get in as many clinics as possible, as quickly as possible.
Well, in regard to the AI component, it's really important, and like you said, it's breaking new ground with regulatory bodies. But what Scientra does is we actually lock down the algorithms, so there's no active learning in regard to our blood tests. Now, this really opens up possibilities because traditionally blood tests have been measuring something like glucose in your blood, and it's very linear. Now we can look at more complex signals. So as we look to introduce this to the broader community, it is disruptive. It does take the community coming together to work through, and any new thing can be a little bit uncomfortable, right? And we have to get past that so we can advance healthcare and improve our options and improve our healthcare for all.
Yeah, you know, I think that if you really want scaling with the tests that we're producing, we really need physician buy-in. And beyond addressing an unmet need, you really need to continuously discuss whether the product that you're creating is actually addressing that unmet need. Health economics is really important. We want to make sure that the organizations that buy our product will get a good return on investment, and then continued evidence creation so that clinicians are convinced that this is something that's beneficial to the patient.
Great. Alex, what do you think, given what everyone has set up here today, is like the biggest barrier to clinical adoption for artificial intelligence technologies?
I think, hello, test, working? I think the biggest challenge, thank you. I think the biggest challenge is generalizability, or the issue of generalizability. So what I mean by that is if a data set is trained in Calgary patients and then validated in Toronto patients, how do we know that it's going to work in New York, Boston, and elsewhere? And that's a challenge specific to AI because unlike traditional medical devices, you can't say that, in traditional medical devices you can say it works like this, then does that, therefore it will work in this other place. But for us, there's this term called black box. It's more of a gray box, and we're trying to peer under the hood more and more. But it's difficult to prove that. And in a situation where we're talking about people's health, it matters. You know, if algorithm misclassifies your picture as having a cat instead of a dog, it doesn't matter. But when it comes to people's health, it does matter more. And so I think there are different approaches, and this is a challenge for regulators, vendors, as well as the medical community, because ultimately they're the ones that are buying these products, adopting these products, and it's their patients' lives on the line. So there needs to be confidence built. I think that some of the things that are being done are physician bodies are taking this on themselves, and they're creating platforms to validate these algorithms as an unbiased third party before they recommend them or put their stamp of approval. Canadian Association of Radiologists is an example with their Raven platform, where they would work with vendors, take their algorithms to different partners across Canada and make sure it works as far as is reasonable. And I think ultimately it has to be a risk-based approach. You can't prove that it's going to work in every little population, but at the same time, you can't hold back a potentially impactful algorithm because it's going to prevent patients from seeing the benefits of that. So it's a balance.
Reed, have you guys noticed anything as you've rolled it out across different geographies, variations across those locations?
I mean, the short answer is no, not yet. The fact that we don't even know whether a person who speaks a particular language coughs the same as a person who speaks a different kind of language with a different grammatical structure, different phonetic structure, indicates how much more there is to learn about cough. And one of the reasons why we are so invested in our vast network of research partnerships is because we need to learn some of these things to ensure that, yes, we have the heterogeneous data, but we need to make sure that the models are faithful to that.
Awesome. Thank you guys so much for the time today. I really enjoyed the pitches, and have fun for the rest of the day. You're all done now.
Thank you.